the 1,002 patients based on the prevalence who are on dialysis. So, as I've given you, obviously, the mathematics of it, you know, the 800 actually corresponds with, the 800 prevalence corresponds with our second modeling, and the 1,002 also corresponds with our end state modeling, which is the final modeling. So the number of patients by our modeling on dialysis in the country will not be more than the 1,200, which is the maximum, and will not be lower than the 400, as we have indicated. What this means is that the NHIA is able to take on the cost. Now, where do we get the money to pay for these dialysis sessions? First, I've already told you that we do have about 2.2 million left over from our pilot. Our budget for 2025, as projected, is supposed to be about 8.1 billion. Normally, half of that budget goes into claims. So we will do some internal rearrangements. We will look within to see whether to reduce our administrative costs to fund it. It wouldn't be any problem, because at the end of the day, our current budget is about 6.8 billion. So to take 56 out and pay for it is something that we can do. So we also looked at the fact that the manifestos of both parties are on capping the NHI. At the moment, we are capped at about 20%. So again, it's simple mathematics. 20 over 100 times our current budget, which is 6.8 billion. That gives you about 1.3 billion extra funds coming in. And I'm stressing that 1.3 billion extra funds coming in. And if you look at the maximum, which is 57 out of the 1.3 billion, it's actually insignificant. Now, our current budget, even if we are not uncapped, because taxes are overperforming, is expected to be about 8-point-something billion. And we will cover this under our benefit package. So there shouldn't be any problem. The next leg is, what support can the NHI and the Ministry of Health give to these facilities in such a way that they are able to provide these services? So in collaboration with World Bank, the Ministry and the NHI are procuring some dialysis equipment. Currently, we ordered 30 of these equipments. 7 has been delivered. 23 of these equipment is to be cleared from the port. It's currently at the port. 15 additional ones have also been approved by the PPA just last Thursday. So we've set that into motion, we put it into procurement. But the good news is, each 15 of these machines comes with about 2,000 consumables. So it means that with the 45 machines, we have 6,000 set of consumables. 6,000 set of consumables. Now, with this, we have just had a meeting with the heads of facilities, and we are all in agreement that it is something that we can do, and we're going to implement it to the latter in such a way that our patients will benefit from this dialysis program that we are rolling out. With this, I can confidently say that the NHI will be able to fund dialysis in this country over many years. It is sustainable on the NHI, and we are committed to improving, obviously working with the facilities to also deliver the service. Now let me give you 2 additional things that we're going to do. So what is the root cause of all these kidney diseases? So the NHIA this year added preventive and promotive services to the benefit package. So currently, Ghanaians on the amount of birth are being given the opportunity to visit any health facility of their choice to check their diabetes, hypertension, blood pressure, BMI, and weights. What this means is that we will be able to reduce the incidence of kidney diseases. We will early detect it. We will also be able to detect hypertension and diabetes early for us to treat them. The next leg is the organ donation policy. The ministry, in consultation with stakeholders, have come up with this policy. It is at the consultation stage. So that will also add on to what we are doing. So with all these approaches, it means that we do have a comprehensive plan to dealing with this dialysis situation in the country. The government is also saying that the Agenda 111 hospitals will be having renal units where modern equipment of dialysis will be put in there to support Ghanaians in such a way that people will not have to travel to Kolebu, Komfanochi, or Kumasi and Accra before they are able to have access to these dialysis sessions. So it will be available in the district. But as we are starting from the 1st of December, we now have listed some facilities across the country, and these facilities are represented here. That is why you see everyone, the heads of the renal units and the CEOs behind me, and some are also seated. So in unity, Ghana will be starting the dialysis program on 1st of December 2024 to bring comfort to our patients. Thank you. This is our performing, and let me at this point say that from 2016 till now, the scheme has actually grown by 6-fold. So we've expanded by 6-fold. So what this means is that we add 2 billion to our budget almost every year. And that is why I told you that our 2024 budget was 6.8 billion. It's moving to about 6.8 point something billion. Normally half of that is for claims. As we speak now, we are in November. Claims payments, the budget for the claims is still being underutilized because claims are, we've paid all claims. We've paid all claims, and it amounted to about 2 point something billion. So we've not even reached 3 billion. So it means we even still have more funds from our claims budget. So what this means is that we've done the modeling and we will be able to sustain it without any problem. The additional 1.3 billion that will be coming in, if you take out 57 million yearly, it's still sustainable over many years. So I think the question of sustainability should not be a problem at all. And that's why we have all these experts helping. We've done the modeling, and that is what I've actually presented to you. It is sustainable over many years. We know the prevalence as well, so there shouldn't be any problem. Yes, the promotive preventive. I think I agree with you. That is the best approach in actually reducing our cost burden. So that is why we have introduced the promotive preventive as part of our benefit package. Now, for our 20-year history, it has been curative. Curative means that you have to be sick before you go to the hospital. Now we are saying that we want to prevent it.
Dialysis and other things. You suggest that the premium is each abstract that you can cover the cost of some of these because it's not about only kidney, maybe prostate and other diseases. And so we need to take there's many people in this country for increase of premium so that we can reach some of the patients. And my second question, Doc, before you came in, we're hearing stories of indebtedness, mismanagement, all kinds of things. Would you say that you have lived up to expectation and nipped all these limitations at the back so that you are doing something that is so wonderful? Because we used to hear some, NHI was ICU, just carried it, because the soil was not very good.
Yes.
Good afternoon. My name is Sarah. I'm a report for TV3. Doctors, I'd like to find out the number of patients estimated to benefit from this particular package. Are those who are seeking alternative options like the herbal medicines for care for their renal disease inclusive? And I also want to find out specifically how many of the facilities are going to enroll this, and have they received part payment of the money needed for the initial start, or there's a timeline for them to bring the money? Thank you.
One is also asking whether it can just belong to any facility at all for treatment.
Okay, thank you. So I think the first one is on the premium. You see, this government is doing something wonderful, and I'm going to explain to you. You see, using digital means, especially using the Ghana card, and also with the expansion that is happening, what this means is that more people are being roped in. And our biggest problem is the informal sector when it comes to the NHI, collection of the premiums and others. But once we are digitalizing and a lot more people are paying taxes and everything, our budget will continue to increase. So I'm even looking at a point where most of the claims are by direct payments, a direct and indirect payment, but by obviously not the premium type, but where we are able to collect it by our taxes as we are doing. So, and the premium is about less than 3% on our budget. So I think in that effect, I think we should just concentrate on how the digitalization will rope in more money for the country in such a way that the NHIS will also get what they want. Then inclusion of other diseases. Was that the question? Okay. So if you look at it carefully, this year or since 2017, we have actually added some complex diseases on our NHIS benefit package. And we've been able to afford it without any for childhood cancer, the 4 childhood cancers, sickle cell, recently in collaboration with Roche, Herceptin for breast cancer. So we are doing a lot. But again, Oliver will continue to ask for more. So people will continue to advocate that we add more. But we'll take it stepwise and look at it and see if obviously we will be able to do the modeling and see which ones to add and which ones we have to obviously dialogue and add later. But at the moment, what we have is what we have modeled, and we believe that we will be able to fund this without any problem. Sarah, what was your question?
Medicine, are they all captured in the benefit package? And also, how many facilities are we looking at? Have there been initial payments to the facilities, or there is a scheduled timeline?
Okay, so thank you. I mean, NHI do not cover alternative medicine. That's it's not part of our benefit package. In terms of the facilities, for now, when we did the assessment, we do have about 40 facilities, but what we're going to do is for our QA to work hand in hand with them. That is why those 40 facilities are here. So this is why we're dialoguing. So across the country, it will be open to these facilities. But more facilities can also be added when we have credentialed them. The fact is, NHI, we do have the way we do our things. Unless we assess you and we credential you cannot be part of us. So more facilities, I believe, will apply to be part of us, and we will assess those facilities accordingly.
So the initial payments. Has it been initial payments?
Has there been an initial payment? Have we already paid some?
No, we added it to our benefit package, so they know how to claim. Now the e-claim system, so once they file it monthly and we pay, so they shouldn't. But let me say that, you see, even the pilot that we did, like I told you, we still have money with the facilities. We did global budgets. We gave them a global budget to spend. So we still have money with the facilities, and the facilities are here. They will bear me out. So again, that's.
Good afternoon, Ghana. Good afternoon, His Excellency, and of course, the team up there, Doctor. Great work. Good afternoon, Ghana. Let me start by very quickly saying that I want to commend the good work that's happening here. And in case you may not be aware of what's happening, I'll give you a quick example. I have a big movie premiering on the 29th of November. And in order for you to attend anything like that, you need good health. Something we take for granted, you need good health. Ghana is moving forward in many ways, and we can't be left behind. There are several people who have suffered from kidney disease. People who have died for reasons that they didn't have to. And so when individuals, establishments, institutions take it into their hands to make sure that Ghana is okay, however we are going to do it, it is commendable. And to those who are already suffering from this disease, we want you to know that we are here for you. I'm encouraging you in a small way. I often said very quickly, you know, everybody says sometimes I'm having a bad day, I'm having a bad day. There's no such thing as a bad day, because if there is, try missing one. We are all here, we're all alive, and while we all have a responsibility. In my own small way, the Chris Atto Foundation is responsible for taking care of people and reminding the fellow Ghanaians that we're one. And so, good doctor, I would like to say it right now without taking too much of the time, that we're commending you, we're supporting you, and looking forward to the space and what we can also do to slowly change things and make things better in Ghana. Thank you.
Thank you. I was for Ghana's morning show president. Ghana and I Wafa Kwame Nkrumah Tikesia of OPF. Wafa, can we turn?
For the sake of the cameras, I think I should also speak English. Mine is a recommendation to the organizers and those teams that put these ideas together to make it a reality. And then I have the assurance that they will do proper maintenance culture so that we don't wake up in any of the mornings or evenings to hear that, these machines that we bought are so dysfunctional that people are not even allowed to go and then have access to the facility. So we thank you all for this gesture of making the dialysis machines a reality for people to access to it. Thank you.
Good afternoon, ladies and gentlemen. Good afternoon to the board for NOC. We are highly elated to be here to witness today. And also witnessing today simply means there's hope for the future. I pray this will continue, and I also pray we don't politicize.